The CDC is holding an emergency meeting this week over concerns surrounding heart inflammation in young adults after their second COVID-19 vaccine shot. While this inflammation is rare, the CDC says the link between the two is stronger than they previously thought. Allie Peters talked to a local cardiologist about whether this should be a cause of concern for teens and young adults debating on getting the vaccine. Allie?
Yeah, Maureen, this heart inflammation is being seen primarily in people ages 16 to 24 after their second shot of either the Pfizer or Moderna vaccine. Now, there's still a lot of investigating to be done, but one cardiologist tells me this isn't something totally new when it comes to vaccines, and the risk of getting COVID-19 is far greater.
Across the nation, concerns are rising after reports of heart inflammation after adolescents get their second COVID-19 vaccine.
About 4 days after, we've seen a predominance of adolescent boys between 16 to 24 kind of have this diagnosis of myocarditis.
Local cardiologists say about 80 to 85% of those impacted have made a full recovery. Others still have lingering side effects of what's medically called myocarditis.
So myocarditis is basically inflammation of the heart muscle and sometimes the heart sac that is around the muscle. It basically can cause chest pain, shortness of breath, abnormal heart rhythms, and it's usually diagnosed with EKG.
Experts say while this is a rare side effect, this isn't the first time they've seen myocarditis after a vaccine.
There's been a couple case reports here and there from the flu vaccine. It's been more in mainstream. They've seen it with the smallpox vaccine, which is a live vaccine. But in general, the risk of developing myocarditis with vaccines is extremely low.
But even though it's rare, the inflammation has concerned some. But experts assure those who are worried you're more likely to get myocarditis from catching COVID-19.
You can throw a decimal point and several zeros after it and a random number, and that's probably the percentage risk of developing myocarditis from vaccines.
Now, experts say this inflammation can impact anyone old or young, and they're still trying to figure out why in this specific case with COVID-19 vaccines, it's impacted those ages 16 to 24 more. In the studio, Allie Peters, News 8.
All right, Allie, thank you. The CDC is again holding that emergency meeting on Friday to discuss these reports of inflammation. The organization is looking into a few hundred cases in people under the age of 30 since April. Only a handful were actually hospitalized, and very few were sent to the ICU.